Have you always been a lover of twins? Have you always admired twins when you see them? Twins, triplets, quadruplets, quintuplets, sextuplets, and all the plets in this world. Like whenever you see twins, you're always like, oh Lord, I can't wait to have my own set of twins. Well, if you're that kind of person, or you're just fascinated about the idea of twins and you just want to know all about them and how to conceive them, then this video is for you. I'm not going to come here and say you can conceive twins by chance, it's all by chance and luck and all of that. Well, I'm all about facts, and in this video I'm going to explain factors that can increase your chances of conceiving twins naturally, medications that can increase your chance of having twins, and a procedure that can also increase your chance of conceiving twins. And then when I'm done, I will talk about the signs and symptoms of you being pregnant with twins. Hello guys, what's up and welcome back. This is Everything Health with Nurse Dara. In this channel we get to discuss different topics related to health. If you're seeing this face for the first time, I am Nurse Chidera Cynthia. I'm a registered nurse, registered midwife, registered public health nurse, and a Bachelor of Nursing Science degree holder currently practicing here in Nigeria. If you're interested in this topic, keep watching. I'm going to start this video by explaining the two different types of twins we have. We have two different types of twins, that is the identical twins and the fraternal twins. So the identical twins are the twins that look alike. The resemblance is striking. You can barely differentiate one from another. They are the type of twins that when people look at them, they say that they look each. And identical twins have to be of the same sex. They can never be a boy and a girl. It have to be either two boys or two girls. They have the same height, the same skin color, eye color, hair color, body weight, everything. They look each. Yes, while fraternal twins on the other hand can be a boy and a girl. They just have a normal resemblance like siblings, but they don't look identical. One can even be taller than the other one, or one can be bigger than the other one. These are fraternal twins, and they can be a boy and a girl, or they can be of different genders. Now let's talk about how they were conceived. For identical twins, when intercourse occurs, the sperm moves to the fallopian tube as usual, looks for the egg. One sperm will fertilize one egg that has been released. Okay, then after the fertilization occurs and a zygote is formed, this zygote eventually splits into two and implants itself and begins to develop like two different babies who share one placenta. That is identical twins. Then fraternal twins on the other hand is when a woman releases more than one egg, maybe 2 eggs, 3 eggs, or whatever, and then different sperm, like we know hundreds of millions of sperm cells are actively swimming in after one ejaculate to look for eggs and fertilize, right? So when this woman releases more than one egg, maybe 2 eggs, 3 eggs, or whatever, there are sperm available, okay? As many as the eggs are, each of them can get 1 sperm each. So when different sperm fertilize these different eggs, fertilization occurs and these eggs implant and begins to develop as 2 different babies, 2 different placentas. So they can end up looking like siblings, or they might not even look like each other, but they are not identical. That is fraternal twins. Now let's talk about factors that can naturally increase your chances of conceiving twins. One, we have family history of twins. Like when a couple get married and start having kids, if the woman in particular have a family history of twins, maybe there are twins in her family from the mother's side, the father's side, whatever, but there are twins in her family, it can increase her chance of conceiving twins. But if the husband of this woman have history of twins from his own family, it might not increase their chance of having twins, but when they have daughters, it can increase the chances of their own daughters having twins. The second factor is age. For women greater than 35 years, 36, 37, 38, 39, 40, and all of that, these women have a higher chance of multiple eggs being released during ovulation, and this can lead to twins. The third one is race. Blacks generally have increased chances of conceiving twins. The fourth one is weight. Women with higher body mass index tend to have more levels of estrogen in their body, and estrogen is the hormone that helps with maturation of eggs. When the levels are increased, it can lead to more multiple eggs being matured and released during ovulation, and this can lead to twin pregnancy. The fifth one is height. Some studies show that women who are tall tend to have good chances of conceiving twins than their short counterparts. Hope this doesn't sound like stereotype, but yes, some studies show that women who are taller have good chances of conceiving twins. Then the last one is breastfeeding. We all know that breastfeeding can also be a natural method of contraception for women. That is exclusive breastfeeding. But when a woman eventually gets pregnant while breastfeeding, there are increased chances that she can conceive twins. Now let's talk about fertility treatments that can help you conceive twins. That is medications. But first of all, I'm going to put a disclaimer out there that these drugs I'm about to mention are prescription only drugs. That means your doctor has to be the one to prescribe these drugs for you and monitor you while you're on this drug. Now the first drug we're going to be talking about is clomiphene citrate, that is Clomid. Clomid is a hormonal drug that increases the levels of FSH and LH. We all know that FSH and LH are two reproductive hormones that causes the maturation of eggs and the release of eggs during ovulation. So it simply increases the levels of these two hormones, making multiple eggs to be released during ovulation. So when multiple eggs are released and different sperm cells fertilize these eggs, it can lead to twin pregnancy, triplets, quadruplets, quintuplets, and the rest of them. The second medication is letrozole. Letrozole is also an ovulation stimulation drug that causes multiple eggs to be released, and this can also lead to twin pregnancy. The third one is gonadotropins. Gonadotropins are injectable fertility drugs that can also help stimulate the ovaries to release multiple eggs, and this can also lead to twin pregnancy. So these three drugs I mentioned are going to help to stimulate the ovaries to release multiple eggs and result to twin pregnancy. Now let's talk about a procedure that also increases your chances of conceiving twins. It increases your chances of conceiving twins by over 60%. This makes it the highest method that can increase your chance of conceiving twins, and that is IVF, in vitro fertilization. This procedure can help increase the chance of conceiving both identical and fraternal twins. For fraternal twins, when different eggs are collected from the woman and fertilized there in the lab, they can choose to transfer up to 3 or 4 different zygotes into the woman to increase the chances of at least one of them implanting and eventually becoming a baby. But in a situation whereby all the eggs eventually implants, this can lead to twin pregnancy. Then for identical twins, studies show that the duration of these zygotes there in the lab can increase the chance of these zygotes eventually splitting into 2 and becoming identical twins. Now let's talk about signs that you're actually pregnant with twins. First of all, we have hyperemesis gravidarum, that is excessive vomiting during pregnancy. You're always throwing up excessively. There are other factors that can make you to have this excessive vomiting if you're carrying just one baby, but when the hyperemesis gravidarum is increased, and there are possibilities that you're actually carrying more than one child in your womb. The second one is big abdomen, bigger than the gestational age. For instance, you're 7 weeks pregnant, but your abdomen is big, like you're already 15 weeks pregnant. There are possibilities that your womb is growing more than one baby. Then the highest method to know that you're actually pregnant with twins is when you do an ultrasound scan. An ultrasound scan is going to dictate how many babies you're having. If you're having 1, if you're having 2, if you're having 3, it's going to show you how many babies you are carrying. If your heart desire is to have twins, I'm wishing you good luck with that, and I'm expecting good news from you when you eventually conceive these twins. In my comment section, let's rejoice together. This is it for this video. If you enjoyed watching, please do well to give this video a huge thumbs up, subscribe, leave a comment in the comment section, and I'll be there to respond. Turn on your notification because I have more informative and educative videos coming your way in this channel. Stay tuned and bye for now.